Well, good morning again. This is Dana Parsons. So, welcome to the Coronavirus Weekly Member Update. We appreciate you joining us today. We have three speakers that are going to be joining us. We are going to begin with Tim Catherman with the Department of Medical Assistance Services to talk with you all about how you can apply for CMP funds to support any type of equipment that you need related to nursing home visitations. Then we are going to be talking with Shana Bernard from the Department of Health regarding some VDH updates. And then we are going to be moving in to discussion with Janine Fink-Boyle about CMS updates. I would like to mention we have created a reporting flowchart checklist for our members. The LeadingAge Virginia Public Policy Committee, many thanks to Tracy Jennings, Carrie Davis, and Josh Bagley for helping us with this. We have a flowchart that you can use to check off for nursing homes and assisted living that's linked and with check boxes. You'll be able to add your logo and any additional items that you would like to add to it. It'll be available in Word in our update tomorrow. If anyone would like to receive it earlier, just shoot me an email and I'm happy to send that to you. It will be reflective of changes that Shana is going to be discussing today. So it will have the new portal related to positivity rates. So I hope that you all find that helpful. So, Tim, have you joined us?
Good morning. Can you hear me?
Yes, good morning. Well, over to you to talk about the using CMP funds. We appreciate you joining us today.
Dana, thank you so much for inviting me, and thank you for everyone attending to this presentation. I really appreciate it. The opportunity to talk to you a little bit about the CMP Reinvestment Fund In-Person Visitation Aid Program. Yes, we have a new acronym, I-PVA. And CMS on September the 17th announced the initiation of the program, which allows the reinvestment funds to be used by nursing facilities to promote staff visitation for residents and their loved ones. The program allows for reimbursement of up to $3,000 for nursing facilities to purchase tents for outdoor visitation or some sort of plexiglass dividers to create a physical barrier to reduce the risk of transmission during in-person visits. We have developed a communication plan that includes notifying providers, working with associations such as yours, and posting the information on the DMAS COVID website. Applications are accepted now through Friday, November the 13th. And hopefully this will allow the time frame to prompt facilities to have the IPVAs in place before the beginning of the holiday season. Payments for the applications will be batched weekly. And like the communicative technology program, the payment will be combined with any other scheduled payment that you may receive from DMAS. Based upon the previous CMP communicative technology program, we anticipate making payments for a total of about $500,000. And I'm going to stress this a couple times. All questions should be directed to cmpfunds@dmas.virginia.gov. Next slide, please. I forgot to mention that Evelyn Hardwick is hopefully here joining me. She is with the CMP staff. We also have Courtney Richter. Courtney is out on maternity leave until the middle of the month. So with the previous communicative technology program, correspondence was directed directly to Courtney, but since then we brought on Evelyn. And so we asked that all communication go through that email box, CMP Funds, because that allows for the coordination of response. We will be updating our website under the COVID response. If you go to the main DMAS website, and look for COVID response, then click on for providers. It'll take you, if you scroll to the bottom, we'll have this section banner here for CMP in-person visitation aids. And on it, you'll have the application template and the FAQs, which were also very nicely included in the mailing that Dana did earlier. So since our website has not been updated, please use the link that Dana provided yesterday. Next page, please. And this tells a little bit more about the program. Again, I'll stress that we are accepting applications through 5 p.m. on Friday, November the 13th. And this information, all the bullet points listed here, I'm not going to go through, but you can also find them in the FAQs and the application. It's a very simple, straightforward process, similar to the communicative technology, and so that's why I'm not going to go into details about all of the information at this time. Next page. So the mechanics of how it will work is to the only thing you can use these funds for are for tents or clear dividers. That's it. There's a whole laundry list of exclusions that is much longer than the allowable items, but tents and clear dividers, plexiglass or similar product. The application is the CMS federal application. Dana provided the link previously, and I believe she has done it again in the chat box. I appreciate that, Dana. We ask for one application per facility, and to be sure to include in the email your NPI number. That's not asked for on the application, but in order for DMAS to process payment, we need your NPI number. So it's very simply the application, the FAQs, which Dana provided previously, and you will receive a state approval denial of request for use of CMP funds for COVID IPVA. That is a CMS template that we will be sending back to you. And when we send the response back, we are required by CMS to copy CMS on the notice. And it will be going to that cmp-info@cms.hhs.gov mailbox. So when you receive the notice back from our staff, they will be copied. And that concludes the presentation. Are there any questions? Just remember to send any questions to cmpfunds@dmas.virginia.gov. Feel free to look through the applications and the FAQs, and that should answer everything.
Tim,
Dana, thank you so
yeah,
much
I have
for
a
the
quick question.
presentation.
I have a quick question. If you receive CMP funds for laptops and you did not use the complete 3,000, would you be able to use any of that remaining balance towards some of these supplies?
No.
Okay.
That program was offered in May and concluded, and we are now, that program has ended, so this is strictly tents and dividers.
Okay, great. Well, thank you so much for being on today and providing us with the update.
Well, thank you for the opportunity. I appreciate it, and I hope everyone applies and uses these funds.
Thanks so much.
Mm-hmm.
So over to you, Shayna.
Hi, Dana. Can you hear me?
Yes, thanks so much for joining us today.
Perfect. Yeah, so I have a couple quick updates. So the first one is that LeadingAge has published the PCR test positivity rates by county that can be used to determine the staff testing frequency as dictated by CMS. To sort of determine those rates, we are using CMS CMS methodology. And so I know that there's been some questions and maybe some confusion of, do antigen tests go into this result? And so per the current CMS methodology, it is just PCR results. If CMS changes their methodology, we will also change our methodology as well to align with that. The data will be updated weekly on Monday. And so this is something that nursing homes can use, but as dictated by CMS, you do have to document the source, and then you have to be consistent. So essentially, you just can't cherry pick the better number. We are aware that there potentially could be some discrepancies between what our percent positivity rate is and CMS's is saying for the exact same county. But like I said, we're supposed to be using the same data, and we are using the same methodology. So ideally, those would all match up, and potentially it's only just the lag that maybe CMS has that's causing any sort of discrepancies. But CMS has said that you can use state data. So the link is located there, and so we hope that this is helpful. The other update is that CDC has updated their nursing home testing FAQs to address some of the questions that I know we've been receiving and shifting off to CDC to respond to concerning the false positives for antigen testing. So I just wanted to make everyone aware of the questions that they're answering in that testing nursing home FAQ. So they do have an answer for if a nursing home is concerned about false positive antigen test results, what confirmatory test should be performed, if a confirmatory test is performed on a person with a potential false positive antigen result or a potential false negative, what infection prevention and control measures should be enacted while the result is pending. And then lastly, the other question I thought would be of interest to this group is what infection prevention and control measures should be enacted in response to people with a positive result from an antigen test followed by a negative result from an RT-PCR. So please take a look at those updated FAQs. They do have a lot of information. We're also going to be sharing these with our local health district as well. So I just wanted to make sure everyone was aware of that updated guidance from CDC. That's all I have for right now, Dana. Thank you.
Thank you so much, Shana. We do have a question. Could we please have access to archive data for VDH?
So you're talking about county positivity for previous weeks. Is that?
Yes.
Okay. I will definitely ask if that's available. How far back would you want to go? I guess would be the next question.
Okay. I'm waiting for
so
that.
Maybe.
Mm-hmm.
Yeah. So I don't know, Dana, if that person just wants to email me and then I can direct them to the right person. I wouldn't be the one that has access to that archive data, but can at least connect. If that's a question, I can at least forward that on to our surveillance team.
Okay, thank you. One question that I had received from members is the Office of Licensure and Certification going to accept this data. I don't know if Kim has joined us, but I was on a call with her yesterday. She said they will, that a nursing home needs to determine which site they're going to use. Are they going to use the VDH published data or the CMS information? They would need to choose which one, document it, and use that source consistently.
That is my understanding.
Okay, great. If Kim's on, just if she had anything to add. Okay. Okay, Shana, I just thank you so much for joining us. I just wanted to give everybody another opportunity to ask any more questions. So we do have plenty of time for questions. And Rebecca, if you wanted to unmute yourself to ask any questions related to the positivity data, that'd be great.
Thanks for putting me on the spot.
I'm sorry there. And
No,
she's a newlywed, everyone.
Yeah, thanks. Yeah, so when I heard that we could do we could utilize the VDH versus CMS, and I saw there is a large difference when you look at the comparison and by your counties. I know for Virginia Beach there is a rather large difference. That's why I'm wanting some of this data, because I really want to look at it and analyze where the differences are coming from. Because with CMS, we're still in the over 5 percentile rate, and with VDH, we're down in the 4 percentile rate. So I'm just wanting to go back and look at the archive data and really just see what the differences have been over the last, since we started tracking the positivity rates.
Yeah, and I just want to comment that, our surveillance team started looking at this data a while ago. And so one of the reasons why it kind of took us so long to get this posted is because we want our data to be, as correct as possible. And so they did follow up with CMS, the EDC. A lot of time and effort was spent into trying to figure out the discrepancies. And essentially CMS, hasn't been able to say why the data is different. And a lot of other states have also said that when they look at the data, they're using the CMS methodology. They are also getting discrepancies, but, CMS hasn't been able to state why. I know that they continue to say it's the same data,
Right.
the data that they're from the state. So it, just because it should match, doesn't mean it is matching. However, I have confidence in our surveillance team, and that's kind of what I told them is, this is our data. They have the methodology from CMS. It's CDC methodology, I believe. And so I cannot explain it. The surveillance team cannot explain it. That was one of our hesitations of releasing this, because we don't have an answer for why it's so different. There were some small discrepancies that they noticed whenever they talked to CMS, but nothing that would cause the data to be as different as some of the counties are showing. But again, our decision was we trusted our surveillance team and the data that they put out. So we felt at least comfortable, putting out this data to kind of use for the nursing homes until,
Sure.
we hear anything differently.
Right. Well, I appreciate that. And I was just wanting to look at the information just out of curiosity and just compare from the beginning what the differences were.
Thank you. We also have a question about getting a link to the CDC updated FAQs. We will get that in the chat box here for you shortly. Are there any more questions for Shana? Okay, and I saw that Kim Beasley joined us. I didn't know, I don't want to put you on the spot, but Kim, if you wanted to add anything to Shana, what Shana has said. Okay. All right, great. Well, thank you, Shana. We are going to move.
Dana?
Yes, Kim.
Kim, sorry, I couldn't get myself
Hi,
unmuted.
no problem.
So I think I caught the tail end earlier. I'm trying to multitask here, and I think there may have been a question or something that you asked earlier.
Yes, we were talking about the new dashboard for the positivity rates, and the question that I had received from some members was about whether the Office of Licensure and Certification was going to accept that data. And based on the call that I had with you yesterday, I had conveyed to everyone on the phone that the OLC will, as long as they document which source they're getting their information from and stay with that source consistently.
Correct.
Okay, great. Okay, well, thanks so much. We are going to move on over to a CMS update. Thank you, Janine, for joining us today from LeadingAge. So
You
over
are
to you.
welcome. Good morning.
Over to you,
Good morning,
Janine.
everybody. Yep. Can you hear me?
Yes, we can hear you. Good morning.
Great. Good morning. Thank you for having me today. We are going to go over a couple pieces that CMS has been working on and then distributed in the last week or so. And then I will put a few links in the chat after I talk about them. So the first is regarding emergency preparedness. So back on September 28th, CMS actually finalize the emergency PrEP, which is the Medicare and Medicaid program, the regulatory provisions, which have to do with the efficiency, transparency, and burden reduction. And so if you remember, between emergency preparedness from 2017 to 2019, in 2019, there were some changes and revisions to the final rule. And so now with that final rule, they've become stamped. And so what that has to do is with your emergency preparedness testing exercise requirements. So although the emergency preparedness goes for 17 different types of providers, for long-term care, looking specifically at the exceptions, knowing that you have to still complete your required review of your emergency program annually, what the changes through this particular final rule has to do with your testing exercise. So if you were to pull up the memo, it's a QSO 20-41-all. And remember, all is because it's for 17 provider types. But in the memo, it actually gives you the testing exercise definitions. So knowing that one of the requirements is to do a full-scale exercise, functional exercise, which is either individual facility-based, which is part of the required. And then the other part you have to do is a mock disaster drill or tabletop exercise or a workshop as that exercise of choice. And so what CMS is stating in this memo is just going through what those definitions are, knowing that long-term care providers are still required to provide the training annually, and then any additional training is required when the emergency plan is significantly updated. So how does that come forward now during COVID? So with COVID, there is now the exemption because of assuming that the majority of nursing homes throughout the country have activated their emergency plans. So if you've activated your emergency plan during the pandemic in the last 9 or so months and hadn't done an exercise for your annual, you are exempt from the next required full-scale community-based or individual facility-based functional exercise. So I know that sounds like a mouthful, but the plan should have been, you probably did activate your emergency plan. And so with that, you'll be able to use everything that you've been doing through the pandemic as your check mark for that part of the EP, the emergency prep requirements. The other part, remember though, is that you have to do the exercise of choice. And so you still may need to conduct that exercise of choice following the current public health emergency. And if you are looking to do that, you will be able to kind of look at any sort of mock disaster drill, or what they're really recommending is that you're doing a tabletop exercise or a workshop. And that would be looking at having discussions about your availability of protective equipment, your PPE, your isolation and quarantine areas. So really kind of doing like what they consider a hot wash in regards to any sort of tabletop exercise or workshop. So again, just take a quick look through that memo that came out on the 28th. We have a little bit of analysis on our website. So I just wanted to make sure that I got that out there. Jody and I worked on a nursing home visitation quick reference guide. I'm going to post that in the chat. We took the memo, which I know can be a little unwieldy. I know that I've discussed it here with all of you since that came out on September 17th. But we actually tried to pare down and go through the guidance. Again, now remember, the way we did this is that the guidance might conflict with your state guidance, but we know that as CMS is working with states and working with Virginia on anything that might be in your reopening plan that could be different from the CMS guidance, if there's a particular different mandate. We work specifically on the memo that came out on September 17th to give you kind of a quick reference. And I think what's most important is knowing that there's not a particular F tag. There's not a new F tag as there's been ones through the infection control F tags, but knowing that if you are limiting visitors without a reasonable clinical and safety cause, you may be cited under F563, which is the right to receive or deny visitors. So remember, going against resident rights. So the quick tool is just 2 pages. It just gives bullets on exactly what the memo states and tries to give you kind of a step-by-step what you could be working on to have indoor visitation and or outdoor visitation. And remembering that obviously, as we just had the discussion about county positivity rates, that's where your basis comes for indoor visitation. So I am going to put that in the chat right now, if I can get my screen to do that. Okay, so that's in there. The other part that I want to bring forward and just give some sort of updates that are more coming from LeadingAge National is that Monday we had our weekly, our twice a week call. Also Monday afternoon, Admiral Brett Gerard was on the call, and he spoke about testing. He spoke about the point of care antigen machines. That is recorded. So if you missed it, it's recorded. We also have an overview of his interview with Ruth Katz on our website. And so, please make sure that you take a listen to that. He did talk about, in the case of the listing of the distribution for the point of care machine. So whether it's a BD analyzer, the Veritor, or the Quidel Sophia, that those have all been going out through the end of September. So as we're here today on October 7th, I know that there's been a number of homes in Virginia that received them. And so anyone that has emailed myself or come through Dana, Melissa, or Paula, and you have all been sent to HHS. I know that those are on a distribution allocation, I the next week or two. So whether an address was wrong, they didn't have a CCN number, there could be many reasons. But if you still have not received a POC machine in the next week, and I'm going to put this caveat in there. So if you had to apply for a CLIA waiver, those are just going out now. So as they finish September 30th, that first week to 2 weeks of October, so we're in the middle of it right now, those POC analyzers are going out. So just kind of making that distinction. So if you're going to send me an email to tell me you haven't received one, just know that if you had to apply for a CLIA waiver over the summer, those machines are just being distributed. Now, in addition, we know that the Binax Now cards are being distributed through Abbott, which is also an HHS initiative. And with that, so everyone knows that they're going to red and yellow counties, again, using the county positivity rates. They're also going out to assisted livings and home health and hospice. I do want to know if you have a home health, if you are working with a hospice, please make sure that they both know that we have a survey that Molly Gearin is doing about the Binax cards. It's listed. It came through today on our daily need to know email. If you get that email, please make sure that you respond to that. I'm going to put in our nursing home weekly recap. We do a recap on Fridays that gets sent out. And I know between Dana, Melissa, and Paula, I know it does get sent out to all of you. We do also list it on our coronavirus resources page off of our LeadingAge website. But I do want to make sure that you have access to it. The update itself goes through what's been going on for the week, and then anything that's upcoming for the next week. So we tried to do a recap. And so you'll see the one I just sent was last Friday that's on there. There's also information about Provider Relief Fund, and making sure that there is anything that we've been doing, advocating. And so what you'll see also on here is the 2 letters having to do with testing. So I know I've talked on this call and gotten the questions from a few of you throughout Virginia and also throughout the country about surveyors being tested. And so we sent a letter directly to Seema Verma about getting surveyors tested. I think you will hear, if you listen to the Admiral from Monday, that our understanding is that is being looked at by CMS, and he did say that in the on the call. The other pieces I just want to focus in on is the NHSN, and so NHSN is now collecting data on flu vaccines, and so the CDC is notifying all users, and there was a webinar yesterday on that. But again, it's not a requirement, but they are looking to make sure that if you are you have your flu data, that you can put it into NHSN. So that's another area that I just wanted to discuss. And then lastly, posted that there are 2 Abbott trainings. So with the Binax cards, I will get that put into here for you. That I think just came out at the beginning of the week. There's 2 Abbott trainings this week, which are specifically from Abbott that they're doing. And then in addition, we are having, so LeadingAge itself are having a part 2 with BD, and that is tomorrow afternoon at 3 p.m. Eastern. And the BD team is going to do a overview, obviously, of the Veritor again, but then to focus on batch training. You do need to register for that. And we'll make sure that you have that link too that came out on our daily email. So I think that's everything that I have, Dana. I didn't know. I'm going to come back on and see if there's any.
Yeah, there's some questions in the chat box.
Yeah, let me come on. I'm getting to learn this. I've only been an attendee on Ring before, not with the chat and stuff. So let me just see. Okay, so I see that there's a member asked about the status of the outstanding antigen machines, and we haven't received the machine test kits or the Abbott strips. Okay, so as I said, if you've already had the CLIA waiver, I see this from the member that's asked it. If you have not received it by tomorrow, and if you could just send me an email, and the things that I need in the email that you send me, and please, I would really ask that you CC Dana also, if that's okay, Dana.
Sure. Yeah,
List,
absolutely.
is that I need your CCN number, your actual true mailing address, because I understand from HHS that's been an issue throughout the country. Some organizations have different mailing addresses versus your business address. So what is where you would receive packages and supplies and so forth. So CCN, your rate mailing address, your CLIA number, your CLIA waiver number, and then an attention to administrator or just a contact name and number. So if you can send that. So again, the majority of them on the distribution should have been sent out by the 30th. Doesn't mean that you'd receive it by September 30th, but that you'd be receiving it, depending on the shipping, it could be in a couple days. And with the Abbott, the unfortunate part, and this also was pretty much confirmed on Monday, is that there's not a distribution plan that HHS is releasing about the Abbotts. What they are saying is they're going to red and yellow county nursing homes, and that they would be distributed weekly. So I wish I had a better update for that. So how can you order more Abbott cards? I know that ordering more Abbott cards goes directly through Abbott. So there is a technical email, and I will make sure that gets to all of you too, but you order them directly through Abbott. Okay, I'm coming up a little bit more. So Charlotte is asking, are we exempt from both the community exercise and the tabletop, or just one? When you look through the memo on page 3, it says facilities that activate their emergency plans are exempt from the next required full-scale community-based or individual facility-based functional exercise. So that would be the actual exercise, and then what you would still need to be doing for the requirement would be either you could do a mock disaster drill or a tabletop exercise or workshop. Remember that second one is your choice. And I'm going to come up a little bit more.
Hey, Janine, Pete Savoda with the Central Virginia Healthcare Coalition has put in the chat box that if anyone with the Central region needs a tabletop exercise, to let him know.
Oh, that's great.
And then I assume, Pete, that would be the case with all the other coalitions as well. If you wanted to unmute yourself.
Hey, Dana, it's Pete. Yes, that is correct. Any of the coalitions in the state are more than happy to provide that support. And the other piece that I mentioned, whether it's virtual site visits that we're piloting, I can't speak to the other regions on that concept. I know Eastern is doing something very similar. In fact, that's where we got the concept from. So that's out there too to support the EOP review. Thank you.
So I did see earlier on the call there was a question about the BD supplies. So I was on a call with BD on Monday evening, and my understanding is they are sending this week an email to all of the nursing homes that receive the Veritor with the actual instructions to order more supplies. I think they might have, the way I understand it is that they have some more direct ordering now. So hopefully you'll get that email. If you don't, give me a call, email, and I will I'll link up with our BD reps that we have. Or if you get a chance to go on to the training tomorrow, Jody and Joe will be hosting that. I won't be on that, but you'll have a chance to put that in the questions too. And see, remember that's at 3:00 tomorrow. I see the Abbott training is full. Okay, I will try to get to the people that we talked to at Abbott to see if they'll be able to schedule more. Can't promise on that. And I think that's all the questions I see, because I think the other were having to do with the extra emergency prep exercises. I'm hoping, I think.
Yeah, Janine, thank you. There was a comment, because we only use the CMS data and we have family members challenging our rates because the VDH information is different. I wondered if Kim Beasley wanted to comment on that.
Can you hear me?
Yes.
So the question was the statement was the family members are questioning the difference between the CMS data and the VDH?
Yes.
Yeah. We obviously, as Shana mentioned earlier, we know, we're aware that there is discrepancy between the two data sets, and VDH has worked very hard in trying to determine how CMS is coming up with their data, and to date have not been able to duplicate that data, but feel very strongly about the data that VDH is producing. But again, it is the facility's choice of which data set to use. So again, I mean, I think, my response to families would be that the facilities have to pick one data source to use and stick with that. And obviously, again, we're aware that there are discrepancies between the two.
Thank you. Janine, there's been a question. One question came in: are we required to allow in-person visitation on our transition units under F563? Would this change if we complete an antigen test on every new admission?
Let me see. So the transition unit is, if I can understand what the transition unit is that where you are bringing in new admissions from the hospital?
Nathan, if you want to unmute yourself, that'd be great.
Y'all hear me?
Yes.
Yes, Nathan.
Hey, everyone. Yes, the transition unit is whenever we accept a new admission from, majority of the time is the hospital. They're moved onto this unit for 14 days. They don't have COVID, but we're treating them as if they're on transmission-based precautions. They're all in private rooms, and then they transition off that unit at the end of the 14-day period of time if they're asymptomatic and they're not, showing obviously any signs of illness.
Have they had a test before they've come into that unit?
Most of the time, yes.
Yeah. And I would also kind of defer to the Department of Health, but my understanding is that that you should, if there's no clinical or safety issues, that you would then allow them to have an indoor visitation. Again, if there's a roommate, which it looks like these are not, they're in their individual rooms, or at least they're individually themselves in that room. But if there's nothing that would prevent any clinical or safety issues, I would say yes, you could.
Thank you, Janine.
You're welcome. And I'm trying to see, I put a few other links in the chat, and I know sometimes it's hard to get the links. So if there's something that you're missing, please just let me know. But I put the leadingage.org right to the COVID-19 resource page. Again, I know this is a nursing home call, but I did put the home health and hospice survey if you have another service line or provider or to pass it along. It's to be put through by the 9th, which is Friday. And then I'm hoping that everyone can join our call today if you have a chance. If not, remember our Monday and Wednesday calls are always recorded. I know lots of people sometimes listen to them when they get in the car or in the evenings because you're all very busy. So
Thank you.
Any other questions, Dina?
Yeah, thank you, Janine. I hope you can. I wanted to open up about some issues pertaining to folks who leave to visit or leave the community, and if members could maybe chime in. So I hope you can stay on, and if anybody else has any questions about what Janine raised, put those in the chat box. But we've been getting questions about folks leaving the campus to attend, situations that are funerals,
Yeah.
ill family members, and they're wanting to know how other members are handling if they put them in isolation, quarantine them for a certain amount of days. Are they, are they charging for any of the supplies to do this related to independent living? I wondered if anybody might chime in about how they're handling when folks leave. And what if they test positive? Um, what if they test positive on their third or fifth day back on the campus? What do you do? We're then required to test staff and residents and possibly twice a week, which is costing quite a bit to the community. So I just wanted to open it up for a dialogue to see how other members are handling that issue. Or if anybody on the call wants to clarify what I've said specifically related to them. I'm hearing crickets. Okay.
That's a tough one.
Yeah, I know what you want to say.
Screening and making sure that they have the PPE, but I understand that PPE is really it can be scarce.
Yes, absolutely. Well, we have about 15 minutes left. I forgot to mention that Melissa's on vacation this week. Otherwise, she would be joining us today. But this is a great opportunity if you have any questions. A couple of announcements. We do have an assisted living coaching series coming up. The slide for that is coming up. I hope that you will register for that. It's going to offer 3 CEUs. We actually have one of the sessions, which is going to be on November 6th. We're going to have some members on that with the Department of Social Services and Mary Childs talking through some scenarios. So there are 3 CEUs for that. If that link is not working for everyone, it is in our update. I will be sharing the reporting checklist that I mentioned earlier that has the new link to the VDH portal, also including the CMS positivity rate, whichever one your community wants to use. Again, you'll just need to document and consistently use that source. So that'll be in our update tomorrow. Again, if anybody wants it sooner, please reach out to me and I can send that to you. Our next call is tentatively scheduled for Wednesday, October 15th at 11 o'clock. And I hope you will join us then. We'll keep you posted if that's canceled. We know your time is valuable. So if we don't have issues to address, we are going to cancel the call. But again, last call for questions. You can unmute yourself if you'd like to ask those or put it in the chat box.
Dana, this is Carrie Davis, and
Hi,
I couldn't
Carrie.
find my unmute button earlier. I apologize. You had a question about individuals going on and off campus, and currently right now in our independent living, it's unrestricted unless you happen to be potentially in contact with somebody knowingly that may have had COVID or medically recommended. We're not instituting any type of isolation or quarantine. We do recommend self-monitoring. In our assisted and our healthcare, we're still doing the 14-day isolation once the individual returns. I actually wanted to throw out a question and see if anyone on the call was currently doing in-person inside visitation on healthcare or assisted living, and especially for healthcare, what you're doing to help monitor and follow all the additional infection control guidance for those inside visits. Thank you.
Thanks, Carrie. While everyone's thinking about that, I did get a question, a private question about if the Office of Licensure and Certification could comment on any recommendations for attending funerals in isolation upon return. So I know if Kim wants to think about that, but and then chime in. But is there anybody who wanted to respond to Carrie's question? And Janine, do you also have that email for the Abbott cards that you could put in the chat box?
Yep. Let me just, I don't have it handy. I got to grab it.
Okay.
If you want to close out, I can send it to you and you can send it out with your,
Sure.
will that work out?
Yeah, well, I can share it today with everyone and it'll also be in the update tomorrow.
Yep.
Kim, I hate to put you on the spot, but I wondered if you had any comments regarding that question.
Not at this time. That one I'd like to think about a little bit more.
Okay, great. Okay, thanks. Well, we will definitely, if you have any comments about that, we can share that later on. I'm sorry. Go ahead, Janine.
Dana, it's Rebecca. That's probably why you're not getting a lot of comments on that question.
Okay.
But I wanted to go back to the indoor visits. I think that's going to be a little more difficult for everybody to manage. You have to continue to follow your PPE that you're doing, of course, with your current residents that are on your isolation. Just remember that and continue to maintain the proper standards that we're all reading about when we get all of our guidance. And it's constant overview, and you have to set up what we're going to be doing is setting up time slots for visitation. That way you're maintaining your social distance. So that is one way that we are going to be setting all of this up. Just an idea.
Thank you.
You're welcome.
Dina, I put the email in the chat for Abbott, the one that we've been given. And then I also put the link to the Admiral Jawar interview. And the reason if people get a chance to actually, you could read this is the written part, not obviously the recording. But if you look in there, there's also an email that HHS has regarding the Binax cards, which I'm sorry that I was remiss not stating. But if you're a nursing home or an AL community in a red county, just a red county, and you've not gotten the Binax cards, do you want to email HHS binax@hhs.gov? And so remember, going on your county positivity rates just for the red counties, because they're trying to track that right now to make sure.
Thank you.
First. And they said it'll be busy, so you might not get a response right away. But that's something different from what I was talking about your POC antigen machines.
Okay, great.
That's not the Binax. That's Abbott.
Thank you. We'll get that information out to everybody and in our update. Also, there was recent Virginia Department of Health clinician letter regarding submitting your intent to administer the vaccine. I have that link in the chat box as well. If you intend to do that, you'll need to access this link and register for that. That'll also be in our update tomorrow. Okay. Are there any other comments or questions? Okay, well, thank you, everyone. I look forward to talking with you again next week. And thank you all so very much. Have a great rest of your week. And thank you so much,